precautions at the door. That means I am standard precaution. I'm gonna perform hand hygiene.
Come in.
Hi, my name is Oriana. I'll be your student nurse for today. I'm here to do a quick physical assessment focusing on the head, ears, eyes, nose, and throat. Is that okay with you?
Yes.
Okay, can I verify your name and your date of birth,
Yes,
please?
Alex Hamilton, January 11, 1991.
I'm checking the armband. Okay, do you have any allergies?
Yes, I'm allergic to aspirin.
Okay, and what reaction do you get with this
It's
aspirin?
just rash and hives.
Okay, patient is allergic to aspirin and gets rash and hives. Okay, what is the reason you're seeking care today?
I have difficulty hearing and I have a headache.
You have a headache, okay. Has this happened before?
No.
Okay. Does anything make the pain better or worse?
It gets better if I take long naps, but it gets worse when I listen to music.
When you listen to music, okay. And can you describe the pain for me? Is it like a dull, aching, or
I would
sharp
say
pain?
it's like dull.
Like a dull pain, okay. And is it constant or does it come and go?
It comes and goes. It's intermittent.
Intermittent, okay. And okay, is it only in your head or does it radiate anywhere else?
It's just in my head.
Just in your head. Okay, and okay, on a scale from 1 to 10, 1 being the less painful, 10 being the most painful, what would you rate your pain?
I would say it's a 5.
A 5?
Yeah.
Okay, and when did this start?
2 days ago.
2 days ago? Okay. And are you doing anything to treat it at home?
No, I am not.
No, you're not. Okay. And how does this affect your daily living? Are you having trouble sleeping, eating?
Yes. Not usually trouble sleeping, but mostly like doing activities like walking or like staying awake in general makes me.
Okay. And do you have any medical surgical history?
No,
No?
not really.
Okay, I'm going to ask you a few more questions. They might seem a little bit repetitive. Can you state your name again?
Yeah, Alex Hamilton.
Okay, check your armband. Okay, can you tell me where you're at?
I'm in Burkett Regional Hospital.
Okay, what year is it?
2025.
And why are you here today?
I'm here because I'm having a headache and difficulty hearing.
Okay, and how are you feeling today?
I'm doing okay. Besides, the obvious.
Okay. Patient is alert and oriented ×4 according to time, place, situation, and mood. It matches to affect, and patient is sitting in an erect position at the edge of the bed, and patient appears to have good hygiene and good nutrition. Okay, now I will begin with the physical assessment. Is it okay if I touch you?
Yeah, that's okay.
Okay, I'm going to inspect the head. Okay, head is midline to the shoulders. I will now touch your head. So I'm checking the scalp and the cranium and your hair. So hair is evenly distributed. The cranium is normocephalic and the head appears to have no lesions or bumps. Okay, now I will ask you to do some facial expressions.
Okay.
Can you smile for me? Can you frown? Can you raise your eyebrows? Can you puff your cheeks? Okay, now can you squint your eyes closed, and I'm going to try to open them, okay? Patient's cranial nerves 5 and 7 are intact with no obvious abnormalities. Okay, now I'm going to move on to your eyes. Okay, I'm going to inspect the eyes. I'm sorry, do you wear any eyeglasses or contacts?
No, not at all.
No? Okay. Now I'm going to inspect the eyes. Okay. There is no signs of redness, swelling, or ptosis, and the eyelashes are present. Okay. Now I will check for the sclera and the conjunctiva. So sclera is white, and can you pull your eyelids down for me?
Sure.
Okay, conjunctiva is pink and moist. Okay, now I will check for any ear alignments. So can you look at your pen, my pen for me?
Mm-hmm.
Okay, look at the top. Now look behind my shoulder. Okay, look at the pen. look at the light. Okay, patient appears to have no misalignment or pertusion. Okay, now I will check for perla. So there's gonna be a bright light in your eye, okay? Okay. Patient's pupils are equal, round, and reactive to light, and the accommodation is intact. Okay. Now I will check for these 6 cardinal positions of gaze. So can you look at the top of my pen and just follow my pen? Don't move your head. Patient's 6 cardinal positions of gaze are intact with no obvious abnormalities. Okay, now I'm going to move on to your ears. So I'm going to inspect the external and internal parts of your ears, okay? Do you wear any hearing aids?
No.
No? Okay, now I'll inspect. There is no redness or swelling or any discharge in the ears. Okay, now I'm going to palpate your ears, okay?
Okay.
Is there any pain when I palpate?
No.
There is no pain or swelling when upon palpation. Okay, now I'm going to move on to your nose. Patient's nose is symmetrical to the face and is in the middle. Okay, can you raise your head for me? Okay, there is no discharge, no obvious deformities. Okay, now I will palpate your sinuses. So we have maxillary, ethmoid, and frontal. Was there any pain when I palpitate?
No.
No, okay. Sinuses are non-palpable with no obvious deformities. Okay, now I'm going to inspect your lips. Okay, patient's lips are pink, moist, and not cracked with no lumps or lesions. Okay, now I will check for your inside of your mouth. Can you open your mouth for me? Can you say ah? Okay. Can you stick out your tongue and move it side to side? Okay. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. Can you open your mouth one more time? Sorry. Okay. So patient's uvula is midline and rises when patient says ah. Dentition is intact. Soft and hard palate are intact, and buccal mucosa is pink and moist. Okay. Now I will. Tonsils are a grade level of 1. Okay. Now I will move to your neck. So can you tilt your head back for me? Okay. Trachea is midline to the shoulders, and there are no obvious signs of deformities. Okay. Now I will palpate your lymph nodes.
Okay.
So you have periauricular, postauricular, occipital, submandible, submental, submandibular, tonsillar, superficial, cervical, post-cervical, deep cervical, subclavicular. Okay, was there any pain when I palpitate?
No.
No? Okay. So, patient has no pain upon palpitation. Okay, now I'm gonna ask you to shrug your shoulders up for me and don't let me push down. Okay? Can you tilt your head to the side and don't let me push? Okay, the next side. Okay. Patient's cranial nerve 11 is intact with no obvious deformities. Okay, now I will be assessing your skin. Okay. I'm gonna palpate with the back of my hand. Okay. Patient is warm to touch, skin is dry, and with no obvious deformities or lesions. Okay. And color is appropriate for ethnicity. Okay, can I see your nails, please? Okay. Patient has no clubbing. Okay, is there any pain?
No.
Okay. Patient has no pain when palpitating. Nails are round and translucent. Okay, now I will check for on your lower extremities. I'll palpate. Okay. I'm gonna touch your toenails. Okay. Patient's toenails have no abnormalities. They are translucent, and I will also check for the edema. There is no present edema on upper or lower extremities, and patient was warm and moist to touch for lower extremities. Okay, now I'm gonna be checking for your skin turgor. It's gonna be under. Okay, there is a brisk recoil, which means you are hydrated. Okay, this concludes my assessment. Now I will check for the bed rows. Okay, and I have to make sure that the bed is locked. Okay, are you in a comfortable position?
Yes.
Okay, I'm gonna make sure that your bed is lowered. Can I get you anything before I leave? Any water or ice?
No, it's okay. I'm good. Thank you.
Okay, now I'm gonna hand you this call light. Just let us know if you need anything. And again, thank you for your cooperation and
You're welcome.
attention.
Thank you.
Have a great day.
You too.